Have you felt it? The subtle anxiety when you desperately need to see a doctor. The heavy, sinking feeling when the receptionist delivers the truly bad news that the wait time for a new patient is 3 long, unacceptable months. Or worse, the sudden dread when your actual appointment is rushed aggressively, lasting barely 10 minutes, a fraction of the time you actually need. You walk out with more unanswered questions than you had when you first walked in. You feel unheard and dismissed. You are absolutely not alone in experiencing this deep frustration. This is the harsh, unsettling reality of the primary care shortage that is rapidly sweeping across America and Canada today. It is not just a minor inconvenience. It is a silent, growing, and potentially dangerous public health crisis for every single senior who deeply values their personal independence. The statistical truth is stark. The Association of American Medical Colleges projects a devastating shortage of up to 48,000 primary care physicians by 2036. I want you to sincerely think about that staggering number for just a single moment. It is a monumental figure that directly translates into significantly fewer health options and drastically less time spent communicating your complex needs. This means your health autonomy, your deeply cherished independence, is now directly and immediately at risk. You have worked diligently and tirelessly your entire life to gain control and personal freedom. You deserve to experience a graceful, dignified, comfortable, and independent aging process. I know your greatest, most deep-seated fear is not the simple act of aging itself. It is the profound fear of losing your physical mobility and your sharp mental clarity. It is the fear of becoming a financial or health burden on your busy children. This systemic crisis is not a reason for you to spiral into a deep despair. It is instead a firm, unwavering mandate that demands your immediate attention. It is a mandate for you to immediately step up, embrace your knowledge, and become the master health coordinator of your own personal health journey. You must embrace this powerful and empowering new role now. I am not suggesting you should attempt to replace your doctor. I am suggesting you must empower yourself with the practical, actionable strategies urgently needed to competently navigate this broken, fragmented system, both effectively and safely. In this powerful, information-packed video, I will share the 3 essential rules that will immediately allow you to regain control and safeguard your long-term health independence. These rules are surprisingly simple to implement today, entirely practical in their application, and require no specialized medical knowledge whatsoever. They are your clear, reliable roadmap to immediate peace of mind and long-term security. I urge you to pay especially close attention to rule number 2. It holds the absolute key to stopping dangerous, life-altering medication mix-ups, which is tragically one of the most common and silent killers in our aging population today. Let us start right now with the very first, most immediate step you can take today to reclaim your power. Rule 1. The preparation. Hack. Make your 15 minutes count. Let us honestly face the painful modern reality of the current primary care consultation today. Your doctor's dedicated time reserved specifically for you is relentlessly shrinking, a direct and unfortunate consequence of the widespread shortage. Rigorous medical research consistently shows that the average physician visit now lasts just 15 minutes, or often much less time. For seniors managing complex chronic conditions, 15 minutes is simply and dangerously not enough time to adequately address everything on your mind. This is precisely where the first rule, the essential preparation hack, instantly becomes your most vital and powerful organizational tool. It is the simple hack that completely guarantees you extract the absolute maximum value out of every precious, expensive minute of your scheduled appointment time. Hack number 1, the top 3 rule. You likely have a mental list of 10 distinct aches and concerns you desperately want to discuss with the doctor, but bringing a long, rambling, unstructured, and disorganized list into a tight 15-minute appointment is the single most common and dangerous mistake I consistently see frustrated people make. It immediately forces the busy doctor to rush frantically and superficially through every point you mention, and inevitably, nothing on the long list gets properly or completely addressed. Your overriding goal for your next medical appointment must be a radical and disciplined act of extreme prioritization. You must identify and isolate the top 3 most urgent or concerning health issues on your list, based on pain or immediate function. Under no circumstances should you present more than 3 distinct issues. By rigidly focusing your discussion on just 3 high-priority issues, you give your doctor the necessary mental space, time, and focus to dive deep and fully engage with each one. For each of these top 3 issues, prepare a brief, highly organized, 3-part statement in advance, ready to present flawlessly. First, clearly and concisely describe the primary symptom you are experiencing. Second, state exactly how long the symptom has consistently persisted and troubled you. Third, describe in simple, functional terms how severely this issue is affecting your current quality of life or your daily functional ability. For example, instead of vaguely saying, "My knee hurts sometimes," you precisely say, "My right knee has had a dull ache that limits my walking for 6 weeks, and it makes climbing stairs extremely difficult and painful." By adhering strictly to this structured, efficient format, you instantly elevate yourself from a passive patient hoping to be cured to an organized, respected, and highly active partner in your healthcare team, earning their professional respect. You save precious minutes of time-wasting guesswork and hesitation, and you completely guarantee that your most critical health needs are heard, understood, and acted upon immediately and decisively. Hack number 2, the digital file system. We must actively move past the antiquated era of scribbled post-it notes and disorganized office folders that waste precious time. Immediate and consistent access to accurate, centralized patient data is your single best line of defense against potential medical error. You absolutely need a centralized, flawlessly organized health file that you can completely rely on and easily carry with you at all times. I wholeheartedly recommend permanently migrating to a simple digital file stored safely and securely on your tablet or your personal smartphone for instant access. This digital file should contain just 3 critical categories of information, all highly organized and ready to be shown instantly upon request. First, your full, current, and complete medication list, including precise dosages and frequency of administration for every single drug. Second, the exact dates and concise summary results of your last 3 major tests, screenings, or any significant procedures you have undergone in the past year. Third, a comprehensive, up-to-date list of all specialists you currently see, along with their primary contact information. When you inevitably find yourself rushed in that short, high-pressure appointment, you no longer have to fumble or nervously guess any details about your past medical history. You simply hand over the clearly organized printed document or quickly display the digital file on your screen with confidence. This simple act of organized preparation instantly earns you professional respect and saves 5 critical minutes of time that would otherwise be frustratingly spent searching for information. It radically empowers the physician to focus their limited time on accurate diagnosis and actionable solutions, not on tedious administrative tasks. It is the ultimate act of self-empowerment in the confusing modern healthcare maze. Hack number 3, the advocate principle. I completely understand your deep-seated desire to handle your personal health matters completely independently, but in an emergency health situation or during a consultation about a complex new diagnosis, having a second pair of alert eyes and functioning ears is absolutely non-negotiable for your safety and accurate retention of information. You must commit to bringing a dedicated, focused advocate with you to every single vital medical appointment. This advocate can be your supportive spouse, a trusted friend, or one of your responsible adult children. The primary mistake most people make is that both the patient and the advocate constantly attempt to talk or interrupt the doctor during the discussion portion. This common error is highly inefficient and only serves to confuse the already busy physician. The most effective strategy is the powerful, disciplined, patient speaks, advocate notes approach. The patient, which is you, must do all the speaking, clearly and concisely sharing the top 3 concerns you meticulously prepared. The advocate's role during the discussion must be completely silent and passive. They must listen intently. Their sole and primary job is to take clear, detailed, and legible notes on the doctor's exact recommendations and next steps. They are also explicitly tasked with ensuring the key, critical follow-up questions are asked before the doctor walks out the door. This disciplined, coordinated approach prevents the doctor from being distracted and guarantees that absolutely nothing important is forgotten or misheard by you during a moment of high stress or anxiety. It fundamentally transforms a stressful individual visit into a highly coordinated, effective team effort, working solely for your long-term benefit. Rule 2. The medication chaos mindset. The safety first. The relentless and growing doctor shortage creates a devastating and often terrifying secondary side effect in the system: uncontrolled, uncoordinated medication chaos. As we move past the age of 65, our physical bodies are much more likely to develop and manage multiple chronic health conditions simultaneously. Over half of all Americans aged 65 and older suffer from 2 or more distinct chronic diseases, a challenging and medically complex reality. This challenging reality means you are often taking multiple different prescription medications, prescribed by 3 or 4 different specialists. The danger here is systemic. The cardiologist simply does not always know what the rheumatologist or the neurologist prescribed. This fragmented, isolated approach to prescribing creates a dangerously high-risk scenario for lethal, potentially fatal drug interactions that are missed by the system. This medication chaos is a hidden, insidious threat to your most vital independence, your cognitive clarity, and your long-term vitality. A simple, unchecked mistake in prescription timing or dosage that no one catches can easily lead to a debilitating fall or a costly emergency room visit. And an ER visit is precisely the stressful, high-cost, and exhausting outcome that you are fighting so hard and so wisely to avoid. This brings us to the second, and arguably the most life-preserving and critical rule in our entire self-advocacy system. It is the essential safety-first mindset that actively stops dangerous medication mix-ups and conflicts before they ever have a chance to harm your body. Hack number A, the brown bag review. This hack is shockingly simple to perform, yet tragically, an astonishingly low number of people consistently practice it. Before your next doctor or specialist appointment, I want you to perform a radical and complete inventory. Gather every single pill bottle you currently consume. This must fully include all your current prescription medications, any over-the-counter pain relievers, and any herbal supplements, vitamins, or nutritional powders that you regularly consume and ingest. You must place them all into a single dedicated brown paper bag or a designated container for easy transport. You must then physically present this entire, complete bag to your primary physician or to whichever health professional is currently managing your primary care. The intentional, powerful act of the brown bag review forces that physician to perform a comprehensive, holistic, and detailed look at your entire pharmaceutical intake at one time. It allows them to quickly and easily spot potential, dangerous interactions, eliminate redundant or confusing medications, and safely adjust dosages based on a complete, accurate picture of your consumption habits. This proactive, self-directed review is your most powerful, free, and accessible line of defense against accidental harm, injury, or confusion caused by polypharmacy. The financial cost of this simple, life-saving action is absolutely zero. The potential benefit to your safety, mental clarity, and long-term quality of life is invaluable and could easily be life-saving. Hack number B, the pharmacist as PCP rule. The relentless and growing doctor shortage in primary care means that we must strategically and urgently utilize every highly trained and readily available health professional in our community for support. The professional pharmacist is a hugely important and often vastly underutilized resource in our current, fragmented, and broken healthcare system. Your pharmacist is an absolute expert in complex drug interactions, safe and appropriate dosages, and all potential side effects. I want you to begin thinking of your dedicated pharmacist as your unofficial, second-line primary care physician, specifically for critical medication and supplement management concerns. They are consistently much more readily accessible than your doctor. You must actively develop a strong, professional, and trusting working relationship with your pharmacist starting today. They are highly trained and capable of performing a full medication reconciliation, a detailed, systematic review of all your medications to check for dangerous conflicts. Your pharmacist can routinely and safely answer pressing questions about minor side effects or quick, safe dosage adjustments, faster and far more reliably than waiting days for a doctor's nurse to call you back. Empower your pharmacist today to help coordinate and actively safeguard your medication safety and well-being. Hack number C, the One Pharmacy Rule. Just as you intelligently consolidate your financial accounts for easier and safer tracking, you must consolidate your essential prescriptions. The One Pharmacy Rule states that you must strictly fill all your medications, every single prescription, every over-the-counter drug, and every supplement, at one single pharmacy location, without exception. When you make the critical mistake of using multiple pharmacies, there is absolutely no single point of safety contact actively tracking potential drug conflicts. The dedicated computer system at one pharmacy cannot legally or safely communicate with the corresponding system at another pharmacy. By centralizing all your medication records at one trusted location, you instantly create an automated, foolproof digital safety net for yourself that works 24/7. This single, coordinated system will immediately flag dangerous drug interactions before they are dispensed, providing a crucial and essential layer of protection that you simply do not get if your pills are scattered across 4 different physical locations. This simple logistical decision is a monumental, empowering step in successfully becoming your own master health coordinator, taking control of your daily routine. It is an absolutely non-negotiable rule for anyone managing 2 or more serious chronic health conditions today for their safety. Rule 3. The Empowerment Toolkit. Beyond the clinic. The third and final rule in our system is entirely about making the intentional, confident choice to take proactive, daily control of your health, strategically moving your focus beyond the confines of the traditional, inaccessible clinic model. When physicians and specialized doctors are scarce, unavailable, and difficult to access, you simply cannot afford to remain a passive recipient of care, waiting idly for the next health crisis to strike. You urgently need a proactive toolkit of accessible, effective, and alternative solutions to confidently manage your routine care and ensure your continued vitality. Hack number A. The telehealth option. The doctor shortage is consistently and demonstrably most acute in rural and low-income areas of the country, where travel and access are extremely difficult. But modern technological advancement has provided a powerful, decentralized workaround that works anywhere: telehealth. Telehealth allows you to conduct virtual appointments with certified medical professionals using only your phone, tablet, or home computer, removing the immediate need for a stressful physical visit. This alternative is especially helpful for quick, routine follow-ups, efficiently obtaining necessary prescription refills, and competently managing chronic conditions that are currently stable. Crucially, many Medicare and major private insurance plans now fully cover telehealth services, making it a viable, budget-friendly, and accessible solution for millions of seniors across the nation. I strongly encourage you to actively investigate the availability of community health centers, CHCs, in your immediate residential area, as they are a lifeline for many. These essential centers are federally funded clinics specifically designed to provide high-quality care based on your ability to pay. They often utilize highly qualified nurse practitioners who are frequently available immediately without a long wait list. Do not allow geographical distance or the total lack of local doctors to prevent you from accessing the routine, crucial care you absolutely deserve. You now have powerful digital options that empower you to successfully bypass the long, frustrating, and dangerous waiting lists you are used to. Hack number B. The nutrition trap warning: when we are faced with a health crisis or a profound lack of easy medical access, we often frantically search the internet for quick fix, magical solutions, and miracle cures. Be immediately warned. The digital marketplace is saturated with insidious nutrition traps that prey on your desperation and hope. These are commercially marketed supplements, obscure foods, or treatments that come packaged with spectacular, yet baseless, promises of instant healing, almost always completely lacking in scientific backing or valid evidence. Spending your hard-earned retirement money on expensive, unproven supplements is not actually an act of genuine self-care or responsibility. It is an act of waste. It is often a desperate symptom of deep anxiety driven by the lack of reliable, human medical access and consultation. I urge you to return to the core, proven foundation of lasting health. Simple, affordable, whole foods, backed by tradition and rigorous scientific study, which are always safe. Focus intently on clear, practical, muscle-building food guidance that you can easily follow every day. Concentrate on consistently incorporating more colorful, fresh vegetables, healthy fats, and lean, vitality-sustaining proteins into your daily meals for strength. These practical, sustainable, and powerful dietary adjustments are often demonstrably far more potent for long-term chronic condition management than any specialized expensive pill, powder, or supplement you could ever buy online. Do not trade your vital health independence for a deceptive, false promise of a miracle cure. Seek out simple, proven, and sustainable food solutions that build your health up steadily over time, not deceptively overnight. Hack number C, the daily movement mandate. The foundational core of your physical and sharp mental independence as a senior is your physical strength and your freedom of movement and balance. The single greatest, most dangerous threat to your long-term autonomy is the gradual, silent, and insidious loss of muscle mass, medically known as sarcopenia, which leads to falls. You must now proactively commit to becoming your own dedicated physical health advocate and strength monitor. You must adopt a personal daily movement mandate starting today, non-negotiable and essential. This does not imply purchasing expensive gym memberships or performing strenuous, intimidating workouts. It simply means intentionally incorporating small, accessible, functional exercises into your daily routine and movements wherever you are. Simple, repeatable acts like performing chair squats while waiting for the kettle to boil, walking an extra lap around the house after dinner, or safely lifting light hand weights while watching television. These small, intentional, and consistent actions are the only true, proven way to actively and successfully safeguard your physical independence against frailty, serious falls, and the increasing need for assistance later in life. Your ability to move freely and without assistance is your ultimate freedom and your greatest, most precious tool. Guard it fiercely. Every single day, you are given and able to move. We have walked through the unsettling and frustrating reality of the primary care shortage that affects every senior today. But far more importantly, we have successfully embraced the 3 powerful, self-empowering rules that successfully turn this system-wide crisis into a profound personal opportunity for self-advocacy and control. Rule number 1, the preparation hack. Master your short appointments by diligently presenting only your top 3 most urgent concerns. Rule number 2, the medication chaos mindset. Use the essential brown bag review and commit to the 1 pharmacy rule to guarantee your safety against dangerous drug conflicts. Rule number 3, the Empowerment Toolkit. Strategically utilize telehealth options and embrace the daily movement mandate to secure your long-term health independence. By intentionally implementing these 3 non-negotiable rules starting today, you are not merely surviving the doctor shortage and long waits. You are taking control. You are actively constructing and building a future where you remain confidently and happily in control of your health decisions and your vital records. You are personally ensuring that you age gracefully, remain fully independent, and stay completely free from the haunting fear of becoming a burden on your devoted children. You are fully embracing the step to become your own master health coordinator. I have one final crucial question for you, and I genuinely want to hear your unique perspective and wisdom on this topic. Have you ever felt aggressively rushed during a vital health appointment? What is the one specific thing you currently do to actively and successfully advocate for yourself and your health when facing a long wait time for a specialist? Please share your powerful experiences and your wisdom in the comments section below. Your unique insight helps empower our entire community of seniors and caregivers. Now, as you begin to coordinate your next doctor's visit, you may realize that the most immediate and terrifying danger lies in uncoordinated prescriptions and the increasing risk of drug interactions. The medication mix-up is a true, serious, silent killer in our aging community. That is precisely why I created our Essential Next video for you to watch immediately. It is titled, The Pill-Swapping Crisis: 5 Ways to Stop Dangerous Drug Interactions, No Doctor Needed. Click the link on your screen now to learn how to instantly create a digital shield around your prescription safety and protect your future vitality. Thank you for joining me today and taking control of your well-being. Remember this always: your health is your independence. Guard it well.